Good evening and welcome everyone for today's session. Today's our speaker is Dr. Jessica Monteiro. She's MD in homeopathy and MSc in psychology, and she's presently pursuing fellowship in medical education. 14 years of experience as a consultant and 11 years of experience as a teacher, and presented more than 10 research papers in oral and poster presentations, has been the part of curriculum deciding for BHMS course. She has been working as a internal and external examiner, and presented many papers in many seminars nationally and internationally, and many qualities we have to say about Dr. Jessica. All of you know her very well. Before also she took many classes. Thank you, and we are happy to invite you, Dr. Jessica, to today's session. You are welcome, please. Please unmute, madam.
Thank you so much for the warm welcome and introduction. A very good evening to all the participants and everyone, all those who have joined today for this session. I hope we have a lovely learning from each other. Before I start the session, I hope my slides are visible.
Yeah, visible.
Okay. So the topic for today's session is bioethics in homeopathic practice, navigating individualized care in a complex healthcare world. Like we all know, our healthcare system is completely getting evolved from day to day. So apart from what we need to know in homeopathic clinical knowledge, homeopathic practice, I also feel ethics is another important foundational stone which keeps the medical practice in general and homeopathic practice in particular ethical and patient-centered. So with this thought process in the background, when Dhanush sir asked me for a topic, I said, why don't we talk in bioethics? Because right now I'm working a little on bioethics. So I said this would be an appropriate forum to discuss with the experts who are already into homeopathic practice and the newbies who are just going to start their practice. So with this background, I would like to start my session. So when we are talking about ethics, bioethics, what is ethics and why is it important in homeopathic practice? Of course, this is not a classroom because I'm a teacher. Probably I always think of the question and answer way of understanding. Yeah, you can just reflect for yourself and just for a minute understand what would be ethics and why it is important in homeopathic practice. So ethics is nothing but it is a moral and a social principle that binds, just a minute, that binds the society by uniform opinion or consideration and enables the society to decide what is wrong and what is right. So it's very important when we are dealing with patients and with individuals, we ought to know what is right and what is wrong. And ethics is definitely a branch of philosophy that examines what is right and what is wrong, what should be done and what should not be done. And Dunstan et al., a researcher, defined clinical ethics as the obligation of moral nature which governs the practice of medicine. So when we are dealing with patients in relation to medicine and practicing medicine in general and homeopathy in particular, this is something which should govern our practice, our engagement with patient. Now, how is homeopathy ethics so much intervened with each other? when we look at all the other systems of medicine, philosophy is not an important integral part of their practice. But if you look at homeopathy, homeopathy is ingrained and what do you say, is completely based on philosophical principles. So for us homeopaths, understanding ethics, which is derived from philosophy, is very easy and very important as well. So what are the important aspects of medical practice? So why is this ethical practice so important when we are talking about practice, homeopathic practice? Because it helps us in navigating our clinical competencies. It helps us to be up to date, or it gives us this idea about how important is clinical competency. I cannot say that I have studied something years back and today it is important for me, but I am not going to keep myself updated. So that is not ethical. Respect for patients and their healthcare decisions. Maintaining the primacy of patient's need. Patient's need should be our focus and patient-centered care. So when we are dealing with all these important aspects of medical practice in general and homeopathic practice, ethics plays a very important role for all these things. For understanding why clinical competency is important, how we need to respect the patients and their healthcare decisions, how we need to give importance to patients at the primary outset, and how we need to have patient care or patient-centered care. So once when we are dealing with patients, the primary thing what deals or what keeps the patients and the doctor's relationship very impact is the mutual trust. And when the mutual trust is remains intact is when we focus on the rights, consent, and the confidentiality of the patient. So when we are talking about having a good patient doctor relationship, which is very important in today's scenario, for this to be intact, we need to understand that we have to respect the rights of the patient. We need to have enough consent for the patient for us to start our treatment, and also the confidentiality of our patient, very, very much important in homeopathic care. So why is ethics so much central to what we are talking now? See, what was right in the past or centuries back or decades back, or maybe 4 or 5 decades or 1 or 2 decades back, may not.
Dr. Jessica, yeah, now it started to share the slides. Yeah, now we can see. It's visible.
Okay. Am I visible?
No, you are not visible. Please switch on the camera.
Yes. I'm
Yeah,
so sorry
you are
for the interruption. I don't know what went wrong. Okay, so just coming back to what we were talking about, we were just talking about how we have evolved as a society and how medical science has also evolved. So we were just talking about something called as the paternalistic concept. Now, what is that paternalistic concept is? In the past, the doctors and the relationship between the patient was that they were like the parent of the house. Whatever decision the doctors used to take, maybe 3, 4, 5 decades back, the patients used to just accept. Like we have it in the parent-children and relationship, where the parent takes the decision for the children and the children just go on with it. So this is how it is, and they trusted the doctor completely. But now the paternalistic approach between the doctor and the patient has now become or shifted to patient centric. Here, the patient is the, what do you say, the central, what do you say, the central focus, and the decisions are in consent with the patient. The doctor is no more the highest authority to decide for the patient. It has to be a mutual decision. So we talk about consent, which is or decision making, which is joint decision making, or what we call it as patient centered approach. So that is something which is now very prominent when we talk about the kind of approach what we follow in today's scenario. Now, this is also the ethical part, or the patient doctor relationship over the period has changed depending upon the religious beliefs, social change, behavior of the patients, and the behavior of the physicians. So these are the different, what do you say, the components which has changed or which has added as the factors which has brought this paternalistic view or the approach to a patient centered approach. So this is what we need to understand, what is the type of approach and the relationship which we are dealing with the today's generation or the patients today. So this is what is currently the scenario in the healthcare sector. Now, if you just talk about a little about the background or how the ethics has got slowly evolved into medical field, let us talk about something called as World War II. If you think about, or if you know a little about the history part, during the World War II, the Nazi camps in Germany, the captures or the this of the war were treated so brutally by the Nazi physicians. They were used as experiments, and they were done whatever was not supposed to be done by them. They were just used as something called as guinea pigs. So that the brutality there slowly was the root cause where this ethics started evolving. And then slowly in 1947, the experiments of Tuskegee, what we say as where penicillin was something where the penicillin was discovered. And during this experimentation, there was so much of side effects which were not only to the family but also to the members of the family. So with this, what happened is these two are the main important events in the history which gave rise to ethical codes, or something called as the Hippocratic Oath and the Nuremberg Code. Now, the Nuremberg Code is something which deals or gives us the laws of how we should carry on experiments. So in this view, these two are very important for us to know that this is how ethics has evolved into the medical or healthcare sector, into the medical practice. Now, let us shift a little into the history of homeopathy. If we see Dr. Hahnemann, actually, Dr. Samuel Hahnemann stopped his practice because he was not happy with the brutality which was done to the patients, the harsh treatment what was given to the patients, like bloodletting, leeching, which were really, really harmful for the patients. He just was not able to bear it, and it did not allow his conscience to his ethical principles. This tells us Dr. Samuel Hahnemann was a person with so much of ethics in him, and that is the reason he did not even what do you say, did not even think twice before stopping his practice and just doing some translation for his livelihood. This is the risk he took, and this is what ethics meant for him. And because of this comes a new, like Hippocratic Oath and Nuremberg codes were generated. Homeopathy is an what do you say, and end product of, like, saying standing on the ethical principles. Because he was a person of ethics, I personally believe that homeopathy was discovered. If he was not a person of ethics and he did not care about what was happening to the patients, I think homeopathy would never see the light of this day. So we are so much rooted in ethical principles because Dr. Hahnemann started homeopathy with the ethical principles. And the Hippocratic Oath or the Nuremberg Oath, basically, in Latin, there is a word called as primum non nocere. That means do no harm. The Hippocratic Oath, what we see today, that tells the physicians do no harm. Homeopathy believes, our principles of homeopathy is ideal cure. It is safe, gentle, and rapid cure. Highest mission of a physician is safe, gentle, and permanent restoration or annihilation of the cause. So this is something where I feel there is so much of ethics integrated, embedded in homeopathy. And that is why we as homeopaths of this day need to what do you say, get aware about ethical principles so that we are in tune with what Dr. Hahnemann actually meant for us to be integrated with ethics while practicing homeopathy. So with this background about what is ethics, what is the background or a little history about how ethics got evolved, just understanding a little theoretical definition of ethics, we come into what are the ethical principles. So, Benom and Childress, these are the researchers which came out with four important ethical principles or bioethic principles. That is autonomy, that is the right to self-determination. The patient has the right to take their self-decision. So we cannot deprive the patient of their self-determination or their right to take decision. The second very important ethical principle is beneficence. Beneficence is to do well and to promote well-being. Third is non-maleficence. Non-maleficence is do no harm or avoid harming the patient. And the fourth very important ethical principle is justice. Treat everyone alike. So when we embed ourselves or homeopathic practice with these four bioethical principles, I think we align ourselves with what actually Dr. Hahnemann meant us to be people or practitioners with ethics in them. So autonomy, beneficence, non-maleficence, and justice. So these are the common bioethical principles, or these are the basic foundational bioethical principles. So let us just see one by one. Respect for autonomy. This is, we need to acknowledge that patients have the right to make informed decision. They are the ones who have to make the decision. You can help them to make their decisions, but they are the ones who make the decision about what is their treatment, voluntary decisions about their own bodies and medical care. This principle is the foundation of informed consent. So before doing anything to the patient, you have to have a consent of the patient, truth telling, and patient confidentiality. So when we embed ourselves in this respect for autonomy, I think we get aligned with all the other principles of telling truth to the patient, having the patient confidentiality intact. Next is beneficence, the moral obligation to act for the benefit of the patient and promote the patient's well-being. Sometimes we may, sometimes we may not, in complex healthcare what we are in today, we may sometimes not be able to understand that we need to give importance to the well-being of the patient. So that's very important. Non-maleficence is to avoid unintentional causing injury or harm to patients through their, to either the action or omission. Now, sometimes our actions may cause harm to the patient. Maybe we do not listen to the patient properly, our miscommunication to the patient while we are giving direction to the patients about the medicines. Maybe our actions may not do the right, or it may harm the patient. So that is also very important. Or sometimes we may just omit, भूल गए हम लोग पेशेंट को बोलने के लिए, और भूल गए कि we have to take this into consideration. All these things become very important when we are thinking about non-maleficence. We should utterly avoid intentional causing injury, or either to action or even by omission. पता नहीं हो गया, that is not acceptable. And third is justice, fair, equal, and appropriate treatment to the patient. At that time, what is appropriate to the patient? and it has to be fair and equal to all the people, irrespective about with their caste, creed, sex, religion, all these things. Irrespective of with all these things, we have to be very just to the patient, we have to be very fair to them, and we have to be equal and give them an opportunity for equity. So this is the four important foundational principles of bioethics we need to understand when we are dealing with patients or when we are into homeopathic practice. So, what are the ethical challenges we face today? So, I actually planned the session like, first half section, we will just understand what are the ethical principles, why it is important in homeopathy, and all those things. Let us just discuss and have a discussion about what could be the common ethical challenges which we face in our daily homeopathic practices. And I just framed some case discussion so that we can just have an awareness about what are the common ethical issues we may face or we are facing in today's practice. So, the four main ethical practices challenges which I just took for today's discussion, there are many, many more. We can discuss more, but the four I thought we will discuss is managing chronic cases or diseases ethically, because sometimes when patients come with chronic cases, we give them false hope versus healing. Sometimes healing may not be possible, but some false hope is generated in them. So, how to ethically navigate through this? Confidentiality in deep case taking. When we are doing chronic case taking, you know what are the different aspects of mental sphere, life space history, what we take into consideration. So, how we need to keep the confidentiality impact. A very important debate which we face as homeopaths is placebo debate and the patient belief, and next is professional integrity. So these four is today something what I picked up for discussion. If there are any more, we can definitely discuss. So let me start with the first one: managing chronic disease ethically. So let I just put forward a case scenario where a 52-old patient with long-standing rheumatoid arthritis has been on homeopathic treatment for 2 years. Now, reports during follow-up, he comes out with improvement in pain, but when you look at the X-ray, it reveals the pathological changes is not improved, and there are still pathological changes which are there. The deformities are progressing. He's having Z deformity and all the other deformities are present, and still he refuses some conventional treatment like physiotherapy, which is important. So because he may have like some fear that it is not right or whatever, so the patient says, doctor, I just trust homeopathy, I do not want any treatment. So this is a case scenario most of us come with, like you can just think of so many other scenarios which you may be facing. So we'll just navigate this through how we would as a homeopath go through this. Now, what is the ethical dilemma here? The ethical dilemma is you have to respect patient autonomy, correct? No, the patient says, I just want homeopathy and nothing else. You have to respect it. You cannot say you take this also, you take this, or some may say, no, I am not. So there are so many issues there. Or intervene or recommend referral. You will say, no, I cannot do anything. There are gross pathological changes. Maybe we require some other integrated help. We do not know. These are the dilemmas some of the physicians would have. So, how do you analyze this ethically? Normally, if you want to analyze this ethically, autonomy, patient choice must be respected. When he says, I want this treatment, or there could be vice versa. He is on homeopathic treatment and he says that, doctor, I do not want homeopathy. Now I want to add something else, or I want to stop my treatment. So you have to respect whatever the patient says. Second is beneficence. Aim for the best outcome. So you have to analyze at that case scenario, what is the best outcome of the patient, whether adding something else would be of best outcome, or telling the patient, no, this is maybe few more days, and you know that probably Herring's law of cure is on the process. So many times we see the patient is not happy, but Herring's law of cure, we know that it is in a few days we are going to see cure. So if the best outcome for the patient is yet to come, non-maleficence, delaying effective treatment. Sometimes you may say you also don't know what is happening, but you want the patient to be with you. So just by keeping him or not sending him for reference, you may delay the patient. So these are the ethical analysis. So how we need to ethically approach, as per my best knowledge, this is the disclaimer I would give, that this is how I as an individual would have an ethical approach, that is acknowledge patient's belief. If he says, no, I want to only have homeopathy, acknowledge it and take it forward. If he says, no, doctor, I just want to stop it, I want to go somewhere else, acknowledge that rather than giving your own views to that. And then you explain to the patient the disease progression. Try to make it very clear what is the pathological change in the patient, what would the patient require, whether it is just a palliation that is going to happen because of deep pathological changes, or maybe some added things like physiotherapy or something else could help the pathology get better. So if here you have to clearly define and understand for yourself and also explain to the patient in clear communicative language what are the limitations of homeopathy in structural damage, and probably if there is an integrative approach like adding physiotherapy or something else, rather than completing abandoning the patient. If the patient sometimes says, no, I want to completely go, or you are not happy with the way the patient is dealing with that particular scenario, rather than completely abandoning the patient, we can have an integrative approach. So this is how we can step by step have a understanding with ethical principles how these complex healthcare scenarios can be dealt with. So this is a first case scenario where managing chronic disease ethically was something like, how we navigate through it. Next, we would go to another scenario of confidentiality in deep case takings. Another case scenario we will talk about is a young woman shares her personal issues during case taking of having a marital dissatisfaction, emotional neglect by your husband, history of extramarital relationships. So during the life space history, the patient comes out with all these confidential views of hers. And later, her patient, once your case taking is over, her patient's husband comes and asks you, doctor, what is actually the problem with her? She is so stressed. She doesn't tell me anything, but has she told you anything? This is so many times we come across in cases of adolescent children where the parents come and ask them, or in marital issues where the wife comes and the husband asks us, the husband tells the problems, the wife comes. So we normally come across these issues. So we'll just have a understanding about how we can ethically have an approach. So what would be your ethical dilemma? The ethical dilemma here would be maintaining the confidentiality or share partial information for the benefit of the family. There are two things, two dilemmas which may go on in my mind is, should I maintain the confidentiality, or maybe the husband is so stressed, should I tell some part and keep some part? So these are the dilemmas which we may come across. So ethical analysis, how you can add the principles. Confidentiality is absolute. There is no second way. When the patient has a trust with you, breaking the confidentiality is not a go until and unless you are doing good to the patient. Not good to the family member, but good to the patient. For example, sometimes a patient has suicidal tendencies and you come to know in that. Sometimes if you do not tell the what do you say, family members, maybe the patient would be at a high risk of committing suicide. So there the high risk of harm is great. In this case, confidentiality should be your basic principle, because otherwise you are breaking the trust which the patient has in you during the case taking. And trust is the foundation of homeopathic prescription. We all know that until and unless we have a good rapport with the patient, the rapport is built only when the trust is built within the patient or between the patient and the doctor. So the trust and confidentiality are so much intervened that there is no other go, but you have to analyze this with the second principle of no what you say, beneficence and non-maleficence, harm to the patient, doing good to the patient. So if you feel that by telling it to the family members you are doing more good to the patient, probably then you can think about it. What would be the ethical approach? You have to not disclose any personal information unless it is indicated. And when the patient's family members come and ask such things, you have to respond neutrally. You have to show them that there is some problem the patient is having with you. And why don't you suggest to the family members or the patient to have an open communication between both of them? Or probably you can arrange a counseling session between both of them so that they are able to communicate with each other and tell their problems. So this could be a way of neutrally acting. This is how we need to understand and embed ourselves with ethical principles while dealing with such ethical issues. Now, there is an additional ethical risk which I feel is sometimes when we are going into deep case taking, we try to over question our patients, especially when the patients come and start telling us about their personal history. Over questioning until and unless it is not required by the case, you need to understand that you cannot cross the boundary. Asking deep personal questions until and unless it is very important for your case is very much need to be considered. And sometimes there could be something which is not clinically relevant, so you have to take care how much deep questions you need to ask so that the individualized understanding and the totality of the symptoms. In homeopathy, this is something with a gray lining, so you have to make yourself aware with the ethical principles where you should draw the boundary and where you are ethically allowed to ask questions. So this is very important, and only take that much which is required for the individualized approach to the patient or necessary for the treatment. So this is very important. So when we are talking about confidentiality and trust, then when we think about beneficence and non-maleficence, that gives us the risk of how much should I tell the family members and how much I should not tell the family members. So this is something the bioethical principles help us to navigate such complex cases. We will talk about the another scenario that is the patient's. This is about the third principle, that is placebo debate and patient belief. So now let us talk about another case scenario where the patients or their family members directly ask us the question, Doctor, I read online that homeopathy is just placebo. Is that true? So many times, we come across this question that there is homeopathy a placebo? Or sometimes you yourself have this discussion within the homeopathic fraternity whether placebo giving is okay or whether we need to. So these are so many things. So let us just try to understand the ethical dissection. So ethical dilemma is, should I defend homeopathic strongly, admit the uncertainty, or avoid the question completely? So this is so many, you may say that I just want to avoid the question, or then you start defending, or you may add your own things. So ethical analysis is you sometimes need to tell them what exactly is the placebo if required, but also tell it why it is given. Now, this is a very, very silver lining. Case to case, it is important because some of us, we know the minute the patient comes to know it is a placebo, their psychology changes. So we need to keep, so here the end lining is so many times when you try to explain to the patient understands. Like, you can say that this is a bottle which has the highest medicine. Maybe just one drop is there in this, but still it will help you. So you are also truthful, but you are not deceiving the patient that the whole medicine is in this. So you have to analyze it in gray and white. So where the truthful information is given, but sometimes the patient suddenly may lose the trust in you when you directly tell them that it is a placebo. Now you are adding the principle of beneficence and non-maleficence. Sometimes when you tell completely to the patient, you are doing more harm to the patient rather than doing good to the patient. So in this case, probably you can tweak it and you can just tell them, like what we discussed, maybe a small part of the medicine is there, and this you may need to take it for some time. So this has to be very well when you are ingrained in what is best for the patient rather than just doing it blindly. When you have your self consciousness as why you are doing it, what you are doing is whether it is right or wrong for the patient in the benefit of the patient, then it makes you ethically standard. So this being aware about the ethical principles makes you very, very strong in how to deal with such questions. And integrity forbids deception. So you have your own integrity also, that you are not telling anything lies to the patient, but you are doing it for the benefit of the patient. So here the balanced principle, or here the best approach would be to have a balanced response. Homeopathy is a system of medicine. You can just explain the principles, if possible, to the patient, and then just say how best it is going to help you. So sometimes I completely do not agree that placebo is something like, which is harmful to the patient, because most of the time we see that this has added, sometimes only one dose is required and then we need to wait for the drug to act, especially in deep acting remedies. So in such cases, you are doing good for the patient. Rather than repeatedly adding medicines, you are doing more harm to the principle. So this principle of beneficence and non-maleficence here is aligned to you giving placebo. So here, when we are doing good to the patient, I personally don't believe that it is ethically wrong. So this is how we need to make ourselves aware. And when you are answering these questions to people around, this is something which we need to ingrain in ourselves so that we are ethically aware about what we are doing, and it is also scientifically evident. Next is another case I will try to discuss, and then we'll have some discussions. A last case scenario is a practitioner advertises, last is justice to the patient. Okay. Yeah, professional integrity, sorry. In this case scenario, we will talk about professional integrity. A practitioner advertises permanent cure for diabetes, cancer, and all chronic disease with homeopathy. Now, with all these social media, you see there are so much of advertisement, so much information which is given to the patients. Sometimes it may not be right. So your professional integrity is very important, because we all know that when you there are certain deep rooted pathological cases which cannot be completely cured, or there may be so many things. It is case to case. So when you are giving such advertisement, you are very much ethically responsible of what you are giving and what the patient comes with you, because once you give such advertisements, the patient comes with very high expectations to you, and when you are delivering this high expectation, sometimes the patient comes with a advanced stage of cancer when nothing can be done except for palliation. Nothing can be done, but instead of telling that I am just going to take care of your symptoms and palliate you, you are, because of your advertisement or because you do not want to have that professional integrity, you say no, I'm going to completely cure you. There could be so many such scenarios. So you need to be very clear about what you are dealing with and what is the expectation of the patient that you have put in, and with this expectation, are you delaying the treatment of the patient and eventually breaking the trust of the patient. So this becomes very important when you are talking about professional integrity, and when you take into consideration the beneficence and maleficence to the patient, you it becomes very much aligned. Whatever you do suddenly becomes aligned when you think about justice, beneficence, and maleficence. One of the common when we had this discussion, we had an ethical discussion about this. One of the common scenarios, I of course I have not put it in the slide, but we have this. We also knowingly or unknowingly we try to differentiate patients. on their religion, on probably their social status, because justice in such cases may not be rightly given to them. So whoever is, like, irrespective about what is their social status, what is their sex, what is their religion, they all are eligible to get equal treatment and equal opportunity. So in such cases, even, like, if the patient is coming first and somebody is waiting in line, if you just call them because you know them, this is also not aligned with the principles of ethics. So this is how we need to understand every principle of ethics, so that we are aligned with each other and we know how we can navigate through these issues when we come in day-to-day practice. Would anyone, I would just stop for 1 or 2 minutes here, and we could have some discussion on these cases, or maybe you can give your what do you say, viewpoints, so that we just have a one-to-one discussion, because these are day-to-day issues that we all face. So I'll just stop for 1 or 2 minutes here so that we can just have some discussion here. Anything you want to talk on these four principles or case scenarios?
No, madam. If anyone want to ask anything, you can come forward and raise your hands and ask to Dr. Jessica.
Anything you want to discuss or have your own viewpoint?
Yes, Dr. Jessica, it's really a very good session. You really uh, put forward some of the things that every doctor need to look into. We all know that homeopathy is a system where each and every doctor practice in a different way, because
So can you be a little loud? We can't hear you, I think.
you can hear you now.
Yeah, I think. Yes, now we can.
Yes. Actually, homeopathy is a different system where we have certain protocol to treat. There is no protocol for specific disease, but person to specific treatment. That is individualization, and we will have to stick on to that. But if you look at different type of practitioners here, we can see in front of you that there are practitioners who are just having 10 or 5 patients a day. At the same time, you can see hundreds of patients, even 200 to 300 patients a day. Now, what can be the basic difference? And the thing is that sometimes the most satisfied person may be the person who is having 5 to 10 patients a day. But the thing is that he may be enjoying the things while doing his profession. But when a person who is having 200, 300% who is simply practicing homeopathy for the benefit of patients rather than his personal satisfaction. That's the way he is trying to give his own methodology of treatment, and he develops such a system, and he is having so many patients in front of them. Most of them are getting either cured or palliative methods. So this can happen, but some patient, as you all know, that there is a law which prevent us from giving advertisement. But in the early part of our career, people there was a time people have mouth-to-mouth publicity, but nowadays things are entirely different. As most of the people are sitting in the home and they are simply looking at the mobile phone and looking what is happening every day in and around the world. And in between, sometimes they may look at the YouTube to see what is there for their disease or how it can be managed like that. The time has entirely changed a lot, and all those things will make a big difference when you practice some 30 years back or 40 years back. So what I would like to answer, give some suggestions here is that you just practice your own way. That is the best thing. Of course, if you are getting satisfaction that what you are doing is right, then that's also good, because homeopathy is a system which have certain rules by which you will have to treat the patient. take the case in detail, find the rubric, then do the repertorization. All these things usually do by those practitioners who are coming forward in the beginning of their career. But once you accustomed with the system, people can definitely go to artistic prescription because of the experience. And when you're not able to get the result, then you can confirm that the medicine you given to the patient is right, or if not right, then you can go for repertorization also. That is the basic difference between the person who is enjoying
Yeah.
5 patients a day, because he is doing all those homeopathic protocols in that way. And when the other person who is having 400, 300% a day is doing in that way. So it can go either way. That's what I would like to say.
So basically, I agree with you, sir. But here, I have a little deviated opinion where, if you think about practicing ethically, it is not more for my satisfaction, but the patient's good. What is good for the patient has to be the center. And of course, when the patient is getting the right, what do you say, gentle treatment, if we are doing what is required by a homeopath, giving a highest ideal cure, probably we'll get satisfied. When we are able to give that ideal cure, satisfaction is definitely the side, what you say, is the benefit what we get. So that is something what I would like to add there.
Yes, that's exactly what you are telling. For example, if you get a patient, you see the patient in front of you is passing stool, and the parents are worried about this child is passing so much of stools for the last so many hours, and but they are even cleaning the stool in front of you. But all of a sudden, you notice that the child is not trying, simply passing the stool. There is offensiveness in this room, so you can modify them within a second, and that will. I have seen such cases in front of me. So that's how the patient also was surprised that, oh, what a kind of doctor he is, and how quickly he was able to make the success of this patient. I have seen that such a wonderful case of for this profiling in my clinic itself, and that's how. So that means the experience of the person. That is what that will definitely give good result to the patient also. That's what I would like to, that both the patient as well as the person who is doing this profession also satisfied or enjoy the scenario. That's what.
Yeah. So basically, sir, I was like, with all our homeopathic knowledge and our homeopathic principles, having awareness about what is ethically right and wrong gives us that extra edge about doing the right thing to the patient for the benefit of the patient in the ultimate gain of giving an ideal cure to the patient. So this is what I would like to add a new dimension to what we already know. A new thing is having an awareness about
Yeah.
the ethics, what we need to follow while we are practicing. So that
Yes,
was actually the objective of just making ourselves aware about what are these principles and how we can align that when we are interacting with patients. And that gives us like, a compass of whether I'm doing it right or there is something I'm doing wrong. So that helps us to give us that like, it's like a conscious mind which is telling us whether this is right or no. And that is basically, I think, the thing what Dr. Hahnemann followed, and that is why he stopped his practice, because that was not good for the patient, and he started with homeopathy. So that is the dissection or the origin of what homeopathy basically lies in. That is what I feel. Ethics.
but the thing is that the junior doctors from our community is finding it a little bit difficult to move forward because they are having very good BHMS and D with them, but still they are finding it very, very difficult to move forward with their cases because lack of experience and exposure may be the reason. But uh, we need to find solution for that. That is the biggest challenge in front of us. Only those who are sitting in the colleges as well as professionals who are having very good practice may not bother about all these things. But frankly, we will have to change the scenario. How we can take our junior doctors to top level? Because I know that what happened with the doctors from other professions, particularly the modern, so-called modern medicine, they are the specialist. When a specialist come out from the hospital itself, they are having very good practice and they are able to move forward in a better way. But even our doctors who are having MD degree, but still struggling because they are taught in such a way that you have to do this thing, that thing. You don't do that. You don't do that. But instead, we would have to give them confidence in a different way. To ask them to sit with the private practitioners as well as in government side doctors, so that they can understand how a person can get the knowledge and how they can deliver the best for homeopathy.
True, sir.
Thank you, Dr. Danish, and thank you, Dr. Jessica. Actually, your session of today's is very unique and exactly very important subject also. But we are not bothering about the ethics and all. When we are getting angry to some doctors, we are saying, "Oh, he have no ethics." Likewise, we are
But
saying,
we are not aware actually
yeah,
what are
we are
ethical
not aware.
principles. We are
No,
not
no.
aware. So just to make ourselves, I think tomorrow when we sit in the patient, at least have those four things like, justice, doing good to the patient, allowing the patient to have autonomy for themselves. And this things, if it comes to the mind also, probably we are going to do
Yeah.
more good to the patient. That's something which I feel.
Simply to point someone, we are saying he doesn't have any ethics. Otherwise, we are not aware about the ethics. And
True.
nowadays, I'm seeing not in homeopathic practice. I'm working with the mind session also. In that many of the psychologists, many of them are showing their patients to social media and explaining their problems, and they are shooting some of their problems and they are showing
True.
that to the social media. I feel so,
because they are not following the principle of confidentiality there. That has to be, that is what ethically it is wrong.
One of my friend, even she was she explained about her fear of death before in her family. Suddenly they believes in Javaga and all. So she was afraid of that, and she was sharing to one of the mind practitioners to the story, and they shooted and they were showing to everyone. And in that video, she's pointing that some of my relatives are responsible for this, and she's mentioning some relatives. I was asking her, why you are shooting such a video? And I don't know that they will show to. I was explaining because of my happiness. I was explaining my cure, and they were showing to the social media. They displayed it.
No, that is what. So when you respect the confidentiality of the patient, you know ethically this is wrong.
Yeah.
So then you will not do that. So that gives you a clear cut rather than somebody telling you that you are wrong. Ethically, your conscience starts telling you that I'm doing right or wrong. So this is like, a kind of map to help us to navigate these complex situations, I feel.
Exactly. So I think I felt this is very important subject, and exactly different from our normal classes, and important subject, also unique subject. And thank you so much for giving us the awareness. As you said, we have some we have some points in our memory, but even though if someone is saying, that will wake up from that memory.
True.
And now I think it is the time to move to next session, Malayalam. Thank you so much, Dr. Jessica, for selecting such an important subject, and come again. Thank you so much.
Namaste, Ram sir.
Dr. Ram.
Thank you, Dr. Jessica Monteiro. Very, very thanks. ethics problem, homeopathic is the ideal cure. Cure the patient, not the disease.
Without
Ethics-
saying thanks from Dr. Ram Parvesh sir, there is no end of the session. Thank you so much and love you all. And good
Thank-
to everyone. And we are moving to the next session. I am inviting Dr. P. Shaila for moderating Malayalam session. Doctor, you are welcome.